Assalamualaikum, very good morning to everybody. I would like to thank the organizing committee for inviting me to give a talk in this public forum. Thank you very much for your kind introduction as well. So I'm going to talk today is about food allergy and eczema. How as a parent, how to manage this kind of problems. So before we start, I would like to, get a kind of introduction. What are allergic disease is all about? So at the moment, allergic disease is kind of a leading cause of chronic disorders worldwide. You would say worldwide, right? Not just in Malaysia, not just in other countries. It affects about 20% of people. But it seems that it's been projected maybe the next 10 or 20 years is going to be like half of the population in every country will be affected by allergic disease. So allergic disease is comprised this is a siblings of allergic disease. We have eczema, we have asthma, we have allergic rhinitis, and also food allergy. So all this what we call as atopic or allergic disease, right? So if you talk about allergic disease, not just asthma, it's not just eczema, it's not just food allergy and etc. But it's comprised all these things. And it seems that the prevalence or the occurrence of this allergic disease is actually increasing now. The whole world population is increasing worldwide. So this is what we actually, what we call, is it a kind of disease in the modern world? Allergy epidemic is going on? Or is it like, not just infectious disease that we actually afraid of? Not just infectious disease that we are afraid of. Allergic disease is actually in a rising trend. So maybe in our heads, right, in our mind, we think about food allergy, we think about something like this. Means that our kid cannot expose to milk, cannot expose to egg, or whatever. So is that kind of impression that we have in our mind? Or is it something like an astronaut, covering up, have no joy in life at all? Alright? Is that what you have in mind? Right? So basically food allergy in children, you can see that it's quite common, right? It seems that even the occurrence is actually like, in 1 in 20 in children less than 5 years old. Some other countries up to 2 in 25 children. And for those affected children, 40% actually presented with very severe reactions. Very severe means that they have involvement of the heart and lung symptoms as well. And from these affected children, 30% of them, right, almost 30% of them, not just have one single food allergy, they have multiple food allergy as well. And it seems that for the past 10 or for the past 15 years, the number of children with food allergy is actually increasing. Alright? And those children, when they grow up, they will have more likelihood to have asthma and other allergic conditions as well. And to take care of, you have a child with a food allergy. Who is the best person to take care of your child? Of course, yourself, right? So looking at the prevalence or occurrence of allergic disease, maybe we look just in Southeast Asia, right? Our neighbor, Singapore, they have like 5%. So means that 1 in 20 children have a food allergy. And our neighbor out there, Thailand, is about 6%. Right? But in terms of our own data, we're not really sure because we don't have that kind of data yet. But we can see it's around that figures as well. So basically, food allergy is not something like, my kid or my children has not able to digest a certain kind of food. That's not a food allergy. Right? And it seems that, my children or my kid doesn't like this kind of food, picky eater, right? That's not food allergy as well. Right? Food poisoning? No, it's not food allergy as well, right? After went to kenduri, kahwin or something, or balik, kind of having diarrhea, vomiting, that's not food allergy. Right? Is it a reaction to food additive? No, right? It's not a kind of because of the preservative inside the food, so take that kind of food and then after that, develop allergy. No, it's not a food allergy. So where do this food allergy comes from? Right? So it's happened when our body system actually recognize something which is safe as a harmful. Okay. So it's supposed to be you eat egg, you drink milk and everything. That's a harmful. That's a harmless. All right. But our body system recognize that kind of food as harmful substance, and then what happened is that to fight that harmful substance, our body actually produce a chemical, that's what we call histamine, right? Trying to fight the food that the body thought is actually harmful, right? So this histamine, later on, we create symptoms. That's why you have like rashes, okay, like swelling everywhere, like difficulty in breathing and so on. Right? It runs in the allergic families, all right? But it seems that nowadays we have more food allergy in children without without family history of allergies as well. So I think you have this, have seen this diagram before. Means that if you have both parents, means that mother and father have allergy, whatever lah, asthma, eczema, food allergy, allergic rhinitis. So means that your child or your offspring will have a chance to get the allergy disease about 40 to 60%. It's more if both of you have the same symptoms of allergy. So your children, your kid will have about 70% of having the risk of allergic disease. So now, talking about food allergy again. Now that's what we call a big 8, right? Why 8? It's because these 8 kind of foods that most of the time causing food allergy, which is eggs, milk, fish, right, wheat, shellfish, tree nuts, peanuts and soy. So all these, what we call big 8 allergen, right, that can most commonly cause food allergy in children and also in adults. So in children, majority of food allergy is caused by milk, eggs, peanuts, tree nuts, soy and wheat. So what is tree nuts? Tree nuts basically your almonds, okay, but kuih almonds, alright? Almond, like kuih raya, very popular. Right? Hazelnuts and walnuts, that's what we call tree nuts. Right? So that's tree nuts. So whereas in adults it's more fish and shellfish allergy, not so much of milk, eggs and other things. More of fish, shellfish, and some of the adults will have peanuts and tree nuts as well. So shellfish can be a range of crabs, lobster, prawn and so on. So then you're gonna ask me, or you're gonna ask your doctor. So if my kid or my child have a food allergy, is it forever? Forever, for a long life? Well, some of it, no. Some of it, yes. So some of the food can be outgrown, like milk, like egg, like soy can be outgrown. But some of the food, usually, forever, up to adulthood as well. Usually peanuts, tree nuts, fish, and shellfish. So as a parent, even though you don't have a kid or a child with a food allergy, but I think nowadays when people talking more about food allergy, more about allergic disease and so on, we as a parent should know what kind of symptoms that food allergy, we have to recognize certain symptoms, certain signs of food allergy as well. So usually food allergy symptoms happen within minutes, all right? Within minutes. after eating even a trace, a little bit small amount of food. Right? So it can be like just redness, hives, right, swelling on the skin. It can be like very itchy. Right? If the child already had eczema, it can turn out to be more flare up. Right? It could be also like a tingling or itching in the mouth. Right? You feel that child complain, got some things like my mouth very tingling kind of sensation, right? That kind of things. It can be like full-blown swellings, lips, right? Also swellings of the eyes, the tongue, the throat, and also the part of the body as well. Right? Can present with eczema. Can also present with this kind of presentation, like swelling everywhere, right? And it also can present with like, difficulty in breathing. Right? You see that your child, after taking certain kind of food, started to have cough, started to be a bit more rapid breathing, kind of difficult to breathe and out, right? Maybe a bit of hoarseness in the voice, right? Trouble breathing, and maybe have a crampy abdomen, right? Stomach ache, maybe a bit of kind of vomiting straight away after ingesting certain kind of food, diarrhea, right? And maybe very itchy eyes, all right? Redness, watery, itchy, and some of them can present with, like dizziness, right? Like want to faint. And some children also can present with a bit delayed presentation as well, not to say very immediate presentation. Right? Very delayed kind of presentation means that you see that a baby or a child passing motion more frequent, more loose, more watery. Right? Some babies can present with bloody or stool or some mucus in the stool as well. And especially in a small baby, right, newborn, they can have what we call colic, right? Inconsolable cry, excessive cry. Not sure what's going on to the baby. Cannot be actually soothed. Okay, give feeding and everything, right? Still crying and crying. And some of them can also present with constipation, not just actually diarrhea and loose stool. And we have seen that some patients also can present with redness around the anus, around the genitals and rectum, right? And also those that actually a chronic kind of presentation, they have in terms of growth rate a bit delayed compared to usual kind of growth rate. And I think you have heard about this term, anaphylaxis, right? Anaphylaxis, everywhere you go, you think, doctor said, watch out for anaphylaxis, right? Watch out for these symptoms. So what is it, anaphylaxis? Anaphylaxis is basically a symptoms that involve the heart and the lung. That's all you should know, I think, at the moment. Heart and lungs means that not just swelling over the face, over the eyes, over the lips and so on. They also involve the symptoms correlates to the lungs and also to the heart, such as, alright, again, noisy breathing, difficulty in breathing, more rapid breathing, alright, that kind of presentation, and then feel something very tight in the throat, that because of the swelling in the throat, so cannot breathe, very tight, feel not even to breathe in difficult, to breathe out also difficult, and can have a very rapid heartbeat. You feel that, feel the chest wall feel, why my kid is having this kind of very rapid breathing? And some of the child can present with really already collapse, that kind of limpy, very pale, right, and persistent dizziness. So how to know whether your child having food allergy or not? Right? The best thing is actually go and see your doctor and ask for advice. So what we do usually, we take a thorough, detailed history. We have to make sure that it is really food allergy, not food, what we call, not food poisoning, not other kind of symptoms. So thorough history, very detailed history, and then we ask the parents to avoid the food that you suspect to have a food allergy in your child, and then see whether that symptoms disappeared with avoidance. And then we also ask you to get a diary for a few weeks, jot down everything the kids, your child actually eating during the few weeks, right? And then we can actually do what we call skin prick test. It's not a confirmatory actually. And we can actually proceed with the some blood test as well. And the last thing that we'll do, if let's say some blood test or some skin prick test is not very suggestive, but in terms of likelihood of to get food allergy is very high, then we can do food challenge, meaning that in a hospital, alright, we ask the parents, or we monitor the parents giving the food, small amount of food to a child, and then we see any reaction or not, right? So this thing should be done in hospital, not at home and not outside of the hospital. So skin prick test, usually what we do is that we put a single drop of allergens, right? A single drop of the suspected. For example, this one is more of we put a bit of a drop of cat and dog, or the grass pollen and more of pollens, right? So and then after that we put a single drop of allergens on the skin. Usually kalau if in small child we do it at the back, but in bigger child, in adult we do it on forearm, and then we prick, and then we see the reaction. The reaction is that real appearance after 15 minutes, right? And then we compare with the negative and positive control. So now, what should parents do if you have a child with a food allergy? Right? At the moment, you should know that there's no cure yet at this moment for food allergy. Right? Researchers actually trying to get some studies going on just to find a cure, but not yet at the moment. So what you should do is that food avoidance. That's number one. Just avoid any food that you think is actually, you suspect that food is actually causing the reaction to your child. Not just ingest, not just taking the food, alright? Also in terms of skin contact, okay, prevent or avoid skin contact. For example, you're preparing a peanut butter sandwich, alright? So try not to have a skin contact. After you prepare your peanut butter sandwich for yourself, wash your hands, right, before you touch your baby. So because some babies, some children, even with the skin contact, not actually taking the peanut or taking the food itself, even with the skin contact, they can have serious allergy reaction. And also avoid sharing, alright? So that's why some countries like in Australia, where I used to practice there, even in school, there's a banner saying no food, no peanut, no nuts or whatever. Right? So to that extent. And then you have to really read the food labels. That's a must. Right? I cannot say, okay, is there any peanut or dairy in this thing? I'm not so sure, doctor, because I never read the labels. Right? So if you have a child with food allergy, you have always to read the labels before you buy something. And then furthermore is that you have to communicate and teach, not just communicate with your partner or with your husband or wife. Have to communicate and teach your kids as well. This is, okay, for example, this food, you cannot eat this food, right? Have to be very careful, cannot share this kind of food at school and so on and so on. Alright? You also have to communicate and teach your caretakers. Right? So for example, you have a maid at home, or you send your child to a kindergarten, you send your child to a nursery, daycare, whatever, have to tell them, have to teach them, have to communicate with them. And maybe to the extent you have to consider medic alert, what we call it. your child will be given a medical alert like a bracelet. It says that I'm allergic to something, right? Okay, so this is what I mentioned just now. Some countries have this kind of diagram or notice. Okay, don't bring any kind of products that contain nuts or free nuts or in the classroom. Alright, and the other part you see that bracelet is saying that I'm allergic to peanut or nuts, whatever. Alright, so here in Malaysia we don't see this kind of problem as yet, but we will. I'm assuring you, we will. Alright, maybe the next 10 years from now. So the first thing that we should remember is that medications for this kind of problems are very, very important. So always keep a antihistamine, not just Benadryl. We can keep other sorts of antihistamine. There's lots of antihistamine outside. Alright, when you go to your pharmacy, you ask for antihistamine. So this basically for a mild allergic reaction must keep handy. Alright, even when you travel outside as well. And sometimes for a very severe allergic reaction like anaphylaxis, we as a doctor we prescribe this what we call EpiPen or epinephrine or some we call adrenaline. Familiar with adrenaline, right? Not familiar with epinephrine. So it's same thing, just the name that we use is a bit different. So adrenaline or EpiPen, this EpiPen. So this to be given immediately. Alright. So EpiPen will be prescribed to a child that we suspect to have a very severe allergic reaction before this. Right, so whenever you go, EpiPen should be there. Right, so usually EpiPen one at home, with and the other one we give it to the child when they are at school. So one to be given to a child and one kept at home. So whenever you go, whenever you travel, EpiPen is there. So if let's say accidentally a child, take something and then become very, very symptoms of anaphylaxis, have a serious infection reaction. So just check with this EpiPen. It's lifesaver. So now we come to eczema. So eczema is common. If I'm gonna ask you in this audience, okay, who doesn't have a child with eczema? Maybe less than 10% say that no, I don't have a child with eczema. Most of us will encounter this kind of eczema. It's not our child, maybe our cousin, our nephew, our niece, or whatever. So usually very common. About 20% of children will have this eczema, and about 90% actually have eczema before they turn up to 5 years of age. And when they actually grow up, this eczema will actually disappear. So that's why you see more of eczema when they are actually small, right? Not when they are getting bigger. And whereas only 25% actually continue to have eczema throughout the adulthood. So the other things you should know about eczema is that some factors can trigger eczema, right? Some factors. For example, like if in overseas, okay, the sweater that they wore, right, the heater and everything, the wool, everything, they can actually trigger the eczema to become more redness, more flare up. And the sweat here in Malaysia, most commonly, okay, excessive sweating, right? So you see that your child will have more rashes or more eczema whenever they become sweaty and so on. And then allergens usually like pollens, not so common here in Malaysia, but overseas, pollens, okay, they will have more eczema when pollen seasons comes. And stress, okay, for example, like maybe not so in our children, but you as adult also have eczema as well. So whenever you have stress at work, with your whatever relationship is not good, and you have a stress and you have a flare up of eczema. And sometimes temperature change. For example, like okay, today is not raining, tomorrow is very hot, the next day is raining again, so you can see eczema start to flare up again. And foods as well, right? And also some soaps and detergent also can trigger eczema. And some more you can see that cats and house dust mite also can trigger eczema as well. So what's the common site of eczema? You see that eczema in children, usually over the face, over the neck area, over the elbows, over the wrist, sometimes over the genitals, and behind the knees and also ankles. Okay, you can see that, right? At the elbows, right behind the knees, over the face, okay, over the hands. So in terms of eczema treatment, the goals of the treatment, basically we want to prevent or we want to control the itchiness, because most babies or most children will start to scratch during night time. So that's when they lost their sleeping quality, and right, the next day they'll become more lethargic, not active, because they don't have enough sleep at night. And the other thing is that we want to prevent inflammation. We want to prevent worsening of the condition, and if there's any infection on top of the eczema, so we want to clear up the infection as well, and always keep the skin well hydrated. So how to do that? Alright, you can use emollients. Right. So usually there's many emollients outside there. You can use all sorts of brand of emollients, just that make sure that you don't use soap kind of emollients. Right? No perfume kind of emollients as well. It's just, this kind of soapy-free, perfume-free emollients. And then the next thing, if the child have eczema flare-up, started redness everywhere, so this is the time when we introduce steroids, such as maybe some of you are familiar with hydrocortisone. Okay, some we have bentonate, bevazole, fusico, and so on. And alright, maybe you've never seen this, the kind of bandaging and this thing is if the child is having very, very severe eczema. So we used to do this in Melbourne. So it means that this is what we call wet bandage. So we apply bandage all over, make sure that bandage is actually wet. Alright, so just to make sure that the skin is very well hydrated. So when you apply cream or apply the emollient or apply the steroid, alright, so emollient or this is what we call moisturizer, have to be given, have to apply every day, even though the skin is clear, every day. Alright, like maybe I can say like very religiously you have to follow this. Alright, for steroid only during flare-ups. So how many times a day? So emollients ideally every 3 to 4 hours if the skin is so dry. Alright, every 3 to 4 hours. But for the steroids only once or twice a day. So how much? Depending on the area. If your child is big enough, right? So you have to make sure that you have lots of creams or emollients available. But for the steroid, it's like just your fingertip, right? Very thin. You apply very thin and make sure it's not, like you don't apply like 1 spoon or 1 teaspoon or straight to the flaring up areas. So usually for the emollients, we give to area that you have active eczema, flare-ups, and also a clear skin. But for the steroids, you just apply to the area of flare-ups only. So maybe you're gonna ask a doctor, how to prevent this allergic disease? Is there any way that I could prevent allergic disease? There is some way that you can actually prevent allergic disease. The best thing is breastfeeding. It's simple, alright? You have a baby, you have breastfeeding the baby for at least 6 months, even longer is better. Alright, so breastfeeding. So some say that okay, you don't have to take, avoid taking foods that can actually causing allergic reaction to your child. Yeah, some advocate that kind of therapy, but studies have shown that this kind of preventive strategy is not going to work, right? And you can also introduce like